Welcome to our Women's History Lecture Series. We're super excited about this series and thankful to each of you for joining in for another series presentation. Today, we're actually looking at women in health sciences, such an important field, especially right now, as we are all experiencing so much going on with the pandemic. If we have never been appreciative of our health sciences professionals, we are certainly appreciative right now. And so we are super excited to hear about some trailblazers in health sciences, some women who have made an impact on the field. And then we are also honored to have some CEOs from the hospitals in the areas that we serve who have decided to come and spend a little time with us. We know that their schedules are super busy, but they have decided to spend some time with us and talk about their journey and the impact that they are having as women in the institutions that we serve. So we thank you so much for being here. We're going to start the presentation by hearing from two of our instructors who are going to give presentations on some trailblazers from the past, and then we'll transition to our current trailblazers in the present. So they will introduce themselves, and then we will continue with the presentation that they have pulled together for you all. So thank you for joining in today.
Today, as we discuss the women who have blazed the trail in healthcare, it seems fitting to begin with Florence Nightingale. Ms. Candace Borders, NTCC nursing instructor, will educate us on the life and significance of Ms. Nightingale. Take it away, Candace.
Good afternoon. Thank you for joining us. I'm going to present to you on Florence Nightingale, who was a true trailblazer in nursing. She was involved in philanthropy from a very young age. She knew that nursing was her divine purpose in life from 16. She helped the ill and poor in a village that neighbored her parents' family estate. She started her nursing journey by turning down a marriage proposal from a suitable gentleman. That was what was required of her to do at that time, much to her parents' dismay. She started nursing school at the age of 24, even though her family objected. Her early nursing career, she was the superintendent for the Institution for Sick Gentlewomen in Distressed Circumstances in London. She really improved the nursing care that those patients received, the efficiency of the hospital, and she improved sanitary conditions. This was the first time she really set the standards of care for nursing. However, she felt that nursing, her calling in nursing was to train other nurses. So she left the Institute for Sick Gentlewomen to pursue her dream. Her first real part of nursing and her being the founder of modern day nursing was during the Crimean War. The British government was outraged at the treatment of soldiers during the Crimean War. The Secretary of State at war for the British government specifically requested Miss Nightingale to lead a group of nurses. She was called the Lady with the Lamp because she would wander the wards of the camp at night, and the soldiers would get, their faces would soften with gratitude when they saw her. She had a group of 38 nurses that really established those standards of care that we still use today in nursing. They seem simple, but they included bathing, clean clothing and dressings, adequate food. She really focused on the psychosocial aspect of the soldiers. She provided them with educational and recreational activities. Her biggest claim to fame was reducing the mortality rate from 40% to 2%. And these standards of care earned her fame throughout England. After the Crimean War, she helped improving conditions in hospitals across England. She was named as the first woman on the Royal Statistical Society. She is a true trailblazer as it relates to graphical presentation of data. That's why she was on this statistical society. She continued her practice of healthier medical care by setting up the Army Medical College in Chatham. She opened the first Nightingale Training School at St. Thomas Hospital, and the curriculum of that training school was based on her book, Nursing Notes on Nursing. She is acknowledged as the true pioneer of modern nursing, which makes her a trailblazer. And then she consulted with other countries during times of war that aided in managing the field hospitals and sanitation conditions.
Thank you, Candace. Next, I'd like to welcome Ms. Sonia McVeigh, NTCC nursing instructor, as she discusses the impact that Ms. Mary Eliza Mahoney has had on health sciences. Welcome, Ms. McVeigh.
Good afternoon. Thank you guys so much for having me. Today, I'm here to discuss with you Miss Mary Eliza Mahoney, a true trailblazer. I love the name of Eliza. Miss Mahoney was born in 1845 on May 7th. She was born to free parents who were from North Carolina, and they moved to Massachusetts before the Civil War in hope of establishing a life in which discrimination was not an issue. She died in 1926 at the age of 80. Miss Mahoney was a breast cancer survivor. She was buried in Everett, Massachusetts. Fun fact, she's the cousin of Frederick Douglass. Miss Mahoney's early education consisted of attending the Phillips School in Boston. This was one of the first schools that integrated in 1895. She began attending this school at the age of 10. This is where the seeds for humility and equality were planted. Miss Mahoney had childhood dreams of becoming a nurse, and after school, she embarked on a long, meandering path to becoming a professional nurse. A true trailblazer she was. She secured employment at the New England Women and Children's Hospital. This hospital was unique in that only women and children received services here. There was also an all-female physician staff and ancillary staff. Miss Mahoney held numerous jobs and odd jobs while working there for over 15 years. She worked in housekeeping, the laundry, and she was a cook. She did things I don't think I could have done to become a professional nurse. Miss Mahoney was actually onto something because this hospital established one of the first nursing schools in the United States. The school had a policy in which they only accepted people 31 years of age or younger. But because of Miss Mahoney's hard work and dedication, they allowed her to enter the school in 1878 at the age of 33, graduating in 1879. It was a grueling 16-month program with very long hours. They worked from 5:30 in the morning until 9:30 at night, lectured during the day, and they practiced their skills in the evening. They received a stipend between $1 and $4 per week. Imagine that. The school accepted 42 students, but only 4 graduated, and Miss Mahoney, the trailblazer, was one of those. Her career path was equally diverse. She was a public health nurse because of her belief in equality and eliminating health disparities. She also worked as a private duty nurse, in which her compassion and professionalism were the reason she excelled in this area. She worked up and down the East Coast for rich white families, providing care for them. Miss Mahoney didn't marry either, and she treated those she cared for as her family members. Again, because of her professionalism, she joined the Nurse Associated Alumni of the US and Canada, which today is known as the ANA. Because of her race, she was unwelcomed. So what did this trailblazer do? She co-founded the National Association of Colored Graduate Nurses, which later merged with the ANA. During her career, she worked as a director of the Howard Orphanage Asylum for Black children in Kings Park, Long Island, in New York. She worked for 40 years and retired. But her work didn't stop. She became a women's rights champion and became one of the first women to register to vote in Boston when the passage of the 19th Amendment was completed. She received several awards and memorials throughout her career. She was inducted into the ANA Hall of Fame, and the ANA today still gives out an award in honor of her name. She was also awarded by the AHA. She was awarded by the National Women's Hall of Fame in Seneca Falls, New York, and a grave site was erected in her legacy as a testimony to her legacy. Keeping with the idea of public health, a clinic was established in Oklahoma in her honor. It's named Mary Mahoney Memorial Health Center. Thank you so much for listening.
Thank you, Ms. Hanja. It's inspiring to hear how these women have impacted the field of health sciences over the past hundreds of years. Without their innovation and leadership, health sciences would not be what it is today. It is now with great honor that I introduce to you all 3 women in our community who are blazing trails today. They are the future of healthcare. Our first panelist is Ms. Michelle Kitsutten, President and CEO of North Oaks Health System. Michelle Kitsutten is President and CEO of North Oaks Health System, the Northshore's largest community hospital organization. She has served North Oaks Health System for the past 35 years. With Ms. Sutton's guidance, the North Oaks medical staff has grown from 100 to 400 plus providers. She has played an integral role in development of strategic plans to initiate a $250 million expansion project for the health system. Under her leadership, there have been many new product and service lines introduced, as well as designation of the medical center as a primary stroke center and one of 9 trauma centers in Louisiana. Since 2018, she's overseen a cooperative endeavor agreement with Hood Memorial Hospital, whereby North Oaks Health System provides consultation and leadership to the AMEET Healthcare Facility. A board-certified fellow of the American College of Healthcare Executives, Ms. Sutton earned both a bachelor's degree in marketing and a master's degree in business administration from Southeastern Louisiana University. Our next panelist, Ms. Joan Kaufman, President and CEO of St. Tammany Health System. Ms. Joan Kaufman is the President and CEO of St. Tammany Healthcare System in Covington, Louisiana. St. Tammany Parish Hospital is a 232-bed acute care, not-for-profit community hospital. There are many expansion projects and further service line developments underway there. The facility is focused on wellness, preventative care, and disease management for area residents in collaboration with its medical staff of over 400 providers and 2,500 staff members through its long-term strategic partnership with Ochsner Health System. St. Tammany Parish Hospital has a remarkable history of service and has been recognized nationally for high quality, safety, and the patient experience. Ms. Kaufman earned her Bachelor of Science degree from the College of St. Francis in Joliet, Illinois, and a Master's in Business Administration from the University of New Orleans. Welcome, Ms. Kaufman. Our last finalist is Ms. Sandy Badinger, CEO of Slidell Memorial Hospital. Sandra Badinger is a Chief Executive Officer of the Slidell Division, which includes Slidell Memorial Hospital, Ochsner Medical Center, and the Northshore related clinics and outpatient facilities. Ms. Badinger, who served as interim CEO from December 2019 to April 2020, began her position at SMH as CFO in July of 2012. Ms. Badinger has more than 24 years of experience in healthcare, accounting, and finance, including leadership positions in diverse and multi-hospital systems in the greater New Orleans region. Ms. Badinger holds a Master of Business Administration degree and a Bachelor of Science degree in accounting from the University of New Orleans. Ms. Badinger is married with 2 children and is an active member of St. Jane de Chantal Church. She sits on the St. Tammany Chamber Board, the Northshore Extended Care Hospital Board of Managers, the Ochsner Health Network Executive Committee, and the Northshore Rehabilitation Hospital Board. Please join me in welcoming each of our panelists today. We're super excited to have the opportunity to hear from each of you guys. As the moderator, we'll start by addressing only one of you, but please feel free at any time to offer any additional thoughts that you may have. We look forward to hearing them. So this first question is going to be for all panelists. Since we've already been introduced to you guys by your impressive bios and heard a little bit about your career journey, please tell us, was it your original goal to be the leader of a major hospital system, or somewhere along the way did your journey take an unexpected route? We'll begin that question with Ms. Battinger, please.
Hi, thank you very much, and thanks for joining us today. So my journey in becoming a CEO was definitely unexpected, an unexpected route. As you guys heard in my bio, I've been in a CFO for a little bit over 24 years now, and back in December, an opportunity presented itself, and I decided to accept the position here at Slidell Memorial in Austin Northshore as the CEO. In order to accept this role and move forward and move to the next level, I've had to do a lot of things. One was step out of my comfort zone. So I was very comfortable in my CFO role. I had to learn a lot and continue to learn every day. I think one of the things as a CEO, you learn more and more every single day. So continuously learning. I'm learning to lead by example, be authentic, be humble, and be transparent with my team. I think building a peak performing team has been one of my goals and something that I work on every single day. And at the end of the day, the ability to drive results is what I'm looking to do. So I obviously, as you guys heard from the introduction, I'm the newest CEO on the panel today. And I enjoy working with and learning from both of my colleagues on the Zoom here today, Ms. Joan Kaufman and Ms. Michelle Sutton. So thank you.
Thank you, Ms. Battinger. Ms. Sutton, do you have anything you'd like to add?
Sure. I didn't start off in healthcare. When I graduated from college, I had a career in banking, and I thought I would end up being the CEO of a bank until a member of my family was admitted to, at the time, North Oaks was known as 7th Ward General Hospital. And I fell in love with the hospital, and I said, this place has a great story, and I want to be the person to tell that story. And so using my marketing background, I said, if there's ever an opportunity, I think I want to change industries from finance to healthcare. And as luck would have it, about 2 years later, I was afforded the opportunity to join North Oaks as the chief marketing officer. And I've been here ever since. So my career definitely took a turn, but one that I wouldn't do anything different. I think healthcare is a calling, and it's something I'm very passionate about, and I feel very fortunate to help others.
Thank you, Ms. Sutton. And last, excuse me, Ms. Joan, do you have anything you'd like to add?
Thank you, Brittany. First of all, I too want to just thank all of you for allowing us the opportunity to be together and really talking about women who have proven themselves as trailblazers. And certainly Sandy and Michelle have done exactly that. So it's my honor to be sitting here aside each of them. My career has taken a crazy path. I have to be very honest with you. I began my career as an X-ray technologist. I graduated from the School of Allied Health at Oxnard at the time. And my very first job was here at St. Tammany Health System. And I climbed up through the ranks of operations many times. And suddenly I found myself at the Louisiana clinic with a brand new CEO who called me into his office on a Friday and asked me to consider moving out of operations and into the realm of marketing, as Michelle talked about, business development and physician recruitment. And I thought, I wonder if he wants to fire me because I have zero expertise in those things. But I'll be honest, he saw something in me that I didn't realize. And had I not accepted that role, which I did, I don't know that I would have been able to round out my skill set the way that I was able to do so in that role. So I really am blessed to have had that come to fruition. And then as I moved on and ended up becoming the CEO of the Louisiana Clinic, it became very apparent to me that I wanted to move into the hospital environment. So I transitioned into Tenet Health Systems, first as an assistant vice president at Lindy Boggs Medical Center. And that's when Katrina came along. And one of the things that was a path I hadn't prepared for was what would happen after Katrina. And I was born and raised here in Louisiana. I had no intention of leaving the area, and certainly was in a position after Katrina with a hospital closure that I really needed to look outside of the area. And that called me to the state of Wisconsin, believe it or not, where it's very, very cold. I had no idea that I was going to be relocating to an environment that 7 months out of the year was wind, rain, wind and snow, but certainly that's the best thing that ever happened to me in my career. I had the opportunity to learn from people who really challenged my skill set. And I think that change has benefited my leadership and the ability to really round out my skill set in a very profound way. And one of the things I'll close with that I think has been most beneficial by that experience is that in the state of Wisconsin, they are ranked 23rd in terms of their ability to achieve positive outcome measures, health measures. And as you all know, Louisiana ranks at 49th in most outcome measures. So to me, it is a goal of mine to work with everyone around us in the spirit of what I call co-opetition, because each of us together can play a role, and only together are we going to be able to advance those metrics.
I love that. Thank you, Ms. Kaufman. Those are definitely unexpected routes, but we're really glad that y'all are where y'all are today so that we can learn from each of you. What are some of the challenges that you've seen that female leaders must navigate that you feel may not be as present or as pressing to your male counterparts? We're going to start with Ms. Battinger for that question.
Yes, so I feel like one thing that I've had to navigate a little bit differently from my male counterparts is having the family demands and being a mom. I have 2 boys, and through my career, I've had to be and work hard at being extremely organized, making sure that I had backup plans when the children became either sick or something, as we know as moms, came up unexpectedly. And so that is something I think I've had to always prepare for and always have backup plans and be extremely organized.
Thank you. I know a lot of our students encounter that as well, so it can be done. We appreciate hearing that. Do any of you other ladies want to add to that?
I would just add, I think the challenge for women in the workplace is often getting the same opportunities as men. When you think about men, they're asked to develop in a role where women may be asked to have proven themselves in that space. And I guess what I would call us to greatness in understanding is, let's not let gender bias, the reality of that, really influence who we are as leaders. Build upon our own internal strengths and strive for greatness always. And I do believe that you'll be successful.
And I would add, I agree with Joan wholeheartedly, because I think the greatest gift that women have is, is our ability to be underestimated. And so I love when people underestimate what we can do, because together we do greatness. And if you look around on the Northshore, you've got 3 female hospital CEOs. And that didn't happen by chance. That only happens through hard work. And I love when people underestimate us.
Gives you a chance to show them exactly what you have. Thank you guys for that. The next question that some of our students had is, as a woman, what do you believe is your greatest strength that's aided in your success as a healthcare CEO? Ms. Kaufman?
Thank you. Many years ago, a former CEO and mentor of mine handed me a book The Power of Servant Leadership, written by Robert Greenleaf. And if you're not familiar with servant leadership, it really emphasizes an approach to leadership which places others first always, no matter who they are. And I think what I would share with the group is that if you lead by example and allow others to truly exemplify and refine their own gifts and talents, the team collectively will perform at a far higher level. So I guess what I would say is, don't be afraid to practice active listening. To Michelle's point, people may view you as someone who perhaps doesn't have the strength to stand up in a group, but by listening and learning, you're able to retain that information and build upon your own skill set so that when you do speak, it's truly one with a powerful voice. And the second part of that, in practicing true servant leadership, is that you allow people to really develop their own skills. They feel like they too are an owner in the business and their contributions are valued. So it gives them strength to do a great job as well.
Thank you so much. Ms. Sutton, Ms. Battinger, do you guys have anything to add? Thank you. So Ms. Sutton, of which organizational accomplishment under your leadership are you most proud of today?
There's two. The first one probably is foremost in my mind, and that's been our response to the pandemic. The teamwork, the creativity has been unsurpassed in anything we've been able to accomplish. And I've seen people rise to new levels that I didn't realize they had within themselves. And the passion, the teamwork have been unparalleled. But I think our job as leaders, our job is to give people resources and move out of the way so that they can accomplish truly greatness. The second thing I'm most proud of, when in 1996, I was given the opportunity to lead our clinics. And at that time, we had 2 clinics, we employed 5 physicians. And over the years, we've grown that to 42 physician practices, and we employ 200 providers now. And I take a lot of pride in watching that. And there's a shortage of healthcare providers across the United States, but the culture that we've established here, people are choosing to come and work with us because of the culture that we have established here. And I think that has to do with good leadership and surrounding yourself with the best people and then empowering them to do their job.
Yeah, thank you. Ms. Kaufman, Ms. Battinger, would y'all like to discuss your greatest accomplishments?
I would echo what Michelle said. I think one of the most memorable experiences in my career is the one that I am living and witnessing right now with respect to the resilience and innovation of our team and managing through this pandemic. I think what they too see from us in a leadership role, much like Michelle pointed out, we didn't take as a leadership team our foot off the accelerator in the realm of strategy. So while the front lines were well supported by leadership to do exactly what they needed to do in caring for our patients and our community, leadership continued to move our strategic initiatives forward so that we would come out of the pandemic in a far better position than certainly we went into it. And to the point about, culture of excellence, we are so blessed across the entire Northshore region, whether you talk to Sandy, Michelle, myself, with a team that is just top notch. And when you think about the work that they do, it's hard work, but they come to work every day, knowing that they are taking care of patients who are their friends, their family, acquaintances, and every patient is treated like they are the only patient in the house.
Yes, ma'am. I know you touched on this briefly, Ms. Battinger, but can you talk to us a little bit more about work-life balance? And I know you guys all have families or likely have families and other obligations. What is the biggest advice that you could have in managing it all?
I think one thing, as a leader, a wife, a mom, a daughter, this is very challenging, especially in today's society and in the pandemic, right? There were many hours, much work that needed to be done. I think having support from at home, it starts there. My husband and children are extremely supportive of what I do and help me stay in balance and in check from a family perspective. I think self-care is extremely important, and I don't think as women leaders we do enough of that. I think in order to care for others and do all the things that we need to do, we have to. It starts with taking care of ourselves. So taking whatever it is that revitalizes us is extremely important. We can't be productive and effective to others unless we're taking care of ourselves. I think it's impossible to do these jobs without a great team. I go back to the teamwork, and it's not just the team within the organizations, it's the team outside the organizations. It's my colleagues, Joan and Michelle, who, we pulled together through this COVID-19 pandemic to offer guidance, advice, what some of the creative ideas to learn and get better and better to serve our patients better. So relying on our colleagues, our teammates for support. It is something that I work on every single day. And it is something that I think that I struggle with at times, is my work-life balance. So to be transparent.
Thank you. I appreciate that honesty. I know, many of our students are there, so it's so helpful to see you guys up there in the ladders making those, still balancing things out, but striving and doing so. So Ms. Kaufman, let's go to you next. How did your college and educational experience influence your leadership?
Well, thank you. As I mentioned before, I was a radiologic technologist by background, and I later pursued both my bachelor's degree and my master's degree while working a full-time job and raising a family, which in today's world is certainly not that uncommon. But I also think that working in a clinical role certainly has really helped to support me as I developed my leadership style, because I was used to and learned from others on the front lines. So many things that we would view from the C-suite, as they call us, we wouldn't have awareness of had we not been on the front lines. And I think that's tremendously valuable. I mentioned earlier the real gift to me that is in active listening. And I always reflect upon any big decision, what would the front lines react to this decision with? And certainly, how does it impact our patients? So I would just encourage folks to enjoy the journey. Education is very, very important. We have to pursue it, but certainly always continue that active listening so you can continue to grow, develop, and refine your own skills.
Yes, ma'am. Thank you. Ms. Sutton, can you give us a few examples of your future goals as a female CEO of the hospital system? And do you believe that your gender in any way influences those goals or your approach?
Okay. I have 2 career goals left that I want to achieve before I retire. The first one is I would love to be chairman of the Louisiana Hospital Association. I currently serve on their board of trustees, but I would like to lead that association. The second is I'm currently a governor for the American College of Healthcare Executives, and I would like to be chairman officer one day and lead our professional organization as well before I retire. I also, one of my career goals as CEO is to continue to develop clinical ladders for every position within our facility or career ladders for every position within our healthcare system, because I want our employees to constantly grow and learn and be the best individuals that they can be. So working with our HR leadership team to develop those opportunities for our staff is very important to me. With respect to being a female and do I have to do things differently? I think many times some of the areas I'm trying to get into have been historically male. So I have to do it a little bit better. I have to develop stronger relationships. And I also have to remember to always promote other women that are successful and make sure that we manage up and we're a resource to each other. You've heard both Sandy and Joan say, we talk a lot, the three of us. We lean on each other and we share because we want each other to be the very best that we can be. So I think being females, it comes natural to us to have strong relationships and lend helping hands. So I think we're at an advantage there, maybe over our male counterparts. I don't know if they would share as much as we share.
I love that transparency. All right, let's see, we're getting there towards the end. If you guys could give your younger self advice, that's what all of our students want to know. In your healthcare journey, what would it be? If you could just offer, your greatest piece of advice to each of them. I want to hear from all of y'all for that. But we can begin with Ms. Battinger if you want, and the other ladies can take it from there.
Sure. I would start with surround yourself with a great team. Build a peak performing team, stay positive, never give up, always strive for the next level, get out of your comfort zone. I think that get comfortable with being uncomfortable. And that's a saying that we have here amongst our team members. Healthcare is ever changing, so you have to always be get comfortable not knowing what's going to happen next, the next pandemic, the next change in government regulations. Lead by example, be authentic, be humble, and be transparent. Never stop learning and work hard on that work-life balance. I think one thing, the self-care is extremely important. And Joan talked a lot about the active listening skills. I think that is how we learn and how we get better and how we know that the decisions that we learn how those decisions we make as leaders are going to impact everyone in our organization. And that's important. So thank you.
Ms. Sutton, do you have anything you'd like to add?
Sure. I would say slow down, enjoy the journey, celebrate each milestone, embrace every opportunity you're given, even if you don't recognize it as an opportunity at the time. Don't always look for money for everything you're asked to do. Look at it as an opportunity to gain a new skill set. Many times I was given new roles, new responsibilities without new money, but I looked at it as a way to build my toolbox so that one day I could be CEO because I had all of these experiences. Also, take time to thank the people who helped you along the way. Never, ever treat somebody poorly, because one day that person you may need. And so treat each interaction as if it's your only interaction with them, as a gift, and thank the people who helped you. Really important to show appreciation to those that helped you get where you are. To Sandy's point, always be humble, because by the grace of God, I have this job, but I could lose it tomorrow. And I never forget that.
Thank you, Ms. Sutton. Ms. Kaufman, any last words that you'd like to add?
I love what both Sandy and Michelle have just said, and for whatever reason, it made me think about my mom, who will be 91 in July. She is a retired registered nurse, and she worked for the majority of the time she was raising 4 girls. So I value her courage, her strength, her authenticity, her humility, and I also value my daddy in supporting her at a time when women really were not that active in the workforce. And it actually brought my attention to, well, not that I'm trying to throw in political affiliation, but this is about women in leadership. And I think about Justice Ruth Bader Ginsburg. And she said to everyone, women belong in all places where decisions are being made. It shouldn't be that women are the exception. So I take that and share that with all of you because I want to truly, through the three of us in healthcare, inspire all of you to really refine your gifts and talents and share them with the world and be proud doing it.
Thank you so much. I know I, for one, I really enjoyed having you guys here today. I think it's a treat for us to hear your journey, to hear your thoughts, and to hear your advice most of all. So unless any of you guys have any last words, I'll turn it over to Dr. Montgomery at this point.
Thank you so much, ladies, for agreeing to be a part of this panel. I know myself as a leader, I have taken so much information for you. It was just very valuable to hear your journeys and how sometimes you just have to trust the process and your path will take you to a place that you didn't think, but you can have an awesome impact on others. And just to hear that camaraderie that you all have as leaders and how you are utilizing each other's strengths and skill sets to be successful as a group. I hope that our students are hearing that because that's something that we share with them constantly, is to build those relationships with each other so that they can help each other to flourish and grow and walk this journey together, because you never know when you're going to need to call that former classmate or colleague and say, hey, I'm looking for a job, or hey, there's a job opening at my hospital, And so it's so important to build that networking part of it. A lot of times there's so much competition between women. And so it's important that you guys really pointed out the connection and partnership that you have, because that truly sends a strong message to our students. And that's something that we try to exemplify for them as well. So thank you. We know that your schedules are super busy. So we are honored that you just took the time to pour into our students and our faculty and staff and our community that we serve. And we thank you for everything that you're doing. Thank you for your service to us as we are going through this pandemic. I know it has been extremely stressful for you, but we greatly appreciate the sacrifices, your leadership, and that you have continued to press on. You could not unplug. You had to engage even more and stronger. And so we greatly appreciate that from the Northshore Technical Community College family and community. We appreciate all of those long nights and long days that you have spent to try to keep the citizens in our areas safe and healthy. And we thank you for that. And we thank you for your leadership. So everyone, be sure to continue to tune into our series. As on our next presentation, which will be on tomorrow, we will be looking at women who have made an impact in STEM. So Ms. Adrianisha Frazier, who is one of our biology instructors, will be talking about women who have had an impact in STEM, and also talking about women who have created items that we use in the STEM field. So we're super excited to hear her presentation, and we are just so honored to have been a part of this series so far, and we're excited to see how we will end tomorrow, knowing that we'll end on a strong note. So thank you all for tuning in. We hope you have an awesome day today, and we will see you tomorrow.
Thanks, everyone.
Thank you.
Thank you.